Welcome back to another episode here on the Heart and Hustle podcast. Our next guest says you can't chart vitals if your own heart's not in it. That's what he actually learned after 30 years in leadership. He said he didn't need another job. He actually needed one where it would let him serve his neighbors and die knowing that he left it all on the field. So, Tory, I mean, you had a big career. Why chose this moment, this place to go all in, man?
I think I'm very fortunate that I am able, this will be the last job that I have in my career. And the fact that I was able to return to my community and actually do work that I consider to be vital for the health of the community, not just in the clinical fashion, but unless you have a really robust and comprehensive primary care delivery system in a community, nothing really works well, right? It really is one of those foundational and fundamental elements that any community needs to have to really be successful. So it was just I felt really fortunate and blessed to be able to have the opportunity to come back and finish my career out doing that kind of work.
And you say your last job, man. So what did that really mean to you the first day you're showing up on the job for Open Door?
I think it's interesting as you progress through your career as a leader to really kind of understand where you are in your own career and also where you are in your life, right? I mean, there are seasons to every component. And so I'm fortunate to be at this point in time that this would be the last job that I would probably do in my career. And I've had a very wonderful career as a nurse. I think, fundamentally, I always relate back to my core. And I got my nursing license 40 plus years ago and have had this wonderful opportunity to serve and do a number of different things with that particular career path. So it's fun to be able
Yeah.
to do a variety of things and to explore and continuously learn my whole career.
I was going to ask you, what did you do prior, but you just answered it. You said nursing. So I can only imagine all these years of nursing, there's something you take away from there that allows you to say, you know what, I want to implement everything that was maybe done wrong here or things that I learned here and put it into the Open Door mission. Anything that comes to mind from that you left in the nursing field, you took with you and then brought it back to Open Door?
Yeah, I would go back to being a lifelong learner. I mean, I've always had an intense curiosity and just kind of a voracious appetite for learning. And so, whether it be in my particular field or career, but just in general, I think knowledge is a wonderful thing to have. Um, and that probably stems back to my childhood, riding around. My dad was a salesman, and we would ride with him in his car, and we were always asking him questions, right? And I think that ability to always be curious and ask questions. And one of my favorite examples that I have never forgotten. So this shows how old I am. When I was in junior college, we still had chalkboards.
Lord, I remember those. So cringe.
Chalkboards, and my professor was biology, drew a circle on the chalkboard, and he said, "Everything inside the circle is the things we know, and everything outside the circle is all the things we don't know, and the peripheral of the circle is all the questions we can ask," right? So as we ask more questions and the circle on the inside grows as our knowledge grows, it just turns out we can ask more questions.
Yeah.
And I've always appreciated that if you approach life that way and leadership that way, it gives you this kind of joy of exploration. And so this point in my career, I'm still learning how to be a good leader, right? I'm still learning how to take care of my community because there's always something else to learn.
Oh man, I'm here looking. I had something on my desk that you would have loved, but maybe I moved it recently. But man, where did I put this thing? It was a floppy disk.
Mm-hmm.
I found a floppy disk, and I'm like, I wonder what's in this. Brought it inside to show my wife. So a couple of things that what chalkboard comes to mind. A floppy disk comes to mind. A projector. When I go now to
Uh-huh.
the schools and work, they have this smart board. That I don't know how to turn it on and how to get it on the smart
Yep.
board. I was like, back in the days, they had those clear, transparent sheets that they would just go
You
ahead and
got it.
write, and they'll have to file it away. Like, oh man, nowadays they technology has really
It
taken
is.
over. They don't need to experience that.
Mhm.
Another thing that just brings some memories here is that you mentioned just being curious and asking questions,
Mhm.
right? First of all, my child is doing that now. I have a 4-year-old. She's very curious and asking a lot of questions, but that's truly every single day is a learning lesson.
Mhm.
And I always, when I speak to those that are getting into the leadership roles, I always say it's okay to ask questions because you can only do with what you know. And if you don't know, then how are you supposed to do? So be okay asking away. I tell that to my team all the way. Don't just guess because then you'll just make more work for yourself. You'll end up doing double the work and things like that. So I love that you kind of brought those things in, man. Asking questions, being curious, learning something new every day, and you going into from nursing to now you're the CEO. Is that correct of Open Door?
Yes, yes.
Like, I'm pretty sure questions had to be asked to get to that point. Do you remember some questions you had to ask yourself before taking a role as a CEO?
I've been in leadership for probably 30 years in my career in various ways. And I think one of the greatest privileges that you can have is to actually help lead people versus manage people,
Yeah.
right? I mean, there's a distinct difference between that. And that's a journey that I don't think ever ends, right? On how to be able to lead. And the lessons that you learn along that journey are that fundamentally, especially in healthcare, especially in community health, which I'm engaged in now, is that
Mhm.
we're really a group of people that take care of other people, right? Fundamentally. So my job as a leader is to take care of the folks within my organization so they can care for the folks that come in to receive service, right? And so what that means is the best important thing to do is to go and talk to the people doing the work and asking them how it's going and where are our opportunities to do better or what are the challenges that you're facing, and also, generally, they will know those opportunities and those challenges. They probably have some pretty good ideas on how to overcome those. And so I think as a leader, the important thing is to go and listen to the people that are doing the work and then be the one to help remove the barriers that they find to being able to do their job well. I think if you hire folks that are connected to your mission, then what you really are trying to do is unleash their potential, right?
Correct. Yeah.
So
Allow them to
it's
be creative.
different than managing people. And depending on the kind of work that you do, and I've just been fortunate to be in healthcare where generally people are drawn to the profession because they have an underlying desire to help,
Hmm.
right? We
I like
fortunately
that.
find
No,
a way to make some money in doing it also, but fundamentally people want to help.
I love that you said the managing leader. Like, I was fortunate to be a manager, right? General manager at 19 years old. And that's really the first time I realized I was a leader. I
Hmm.
was leading this team. We wanted to be the better store out of all the districts, and we were. But one thing someone told me, and I had to realize, is some people may not be okay with your leadership for whatever reason that is. And that's okay. And I would remember that I was 19, 20 years old. The gentleman was 50 something years old. And he
Yep.
says, Efrain, I love you. I think you're great. And I think with the right team, you're going to be an amazing leader. I just cannot be a part of this team. And he never really told me why. But now as I look, I'm like, who'd want to listen to I'm 50 some years old and I'm listening to a 19-year-old. But he wasn't saying I wasn't a good leader. I just wasn't the leader for him, right? And then as I continued that path and I realized people get into management and play exactly that role, a manager. But it's not, you're more than a manager. And I think companies don't do enough to actually pour into the leadership aspect of what that actually entails. So I love that you're kind of bringing in a whole bunch of different aspects of leadership and going down your journey, man. And it looks like you got some more stuff to tell. Tell us, Tori.
Well, yeah, no, it's great. It's all, part of the joy of life is having, dialogue with people because you learn things as you go along and it makes you remember things. And there's a distinct difference between management and leadership. And my desire and interest has always led into leadership,
Yeah.
right? And you brought up some interesting things. We have multiple generations in the workforce right now, right? And so
Yep.
your observation, so one thing you have, self-awareness is very important, right? So one of my favorite authors in leadership is a gentleman named Stephen Covey. And one of his core tenets that I've always remembered, he said, first seek to understand, then to be understood.
Love it.
So in your example, right, like to have awareness at 19 is more difficult than to have awareness at 57
Yeah.
of how what is my impact on the person, right? Like so understanding that creates the opportunity for potentially working better together, right? From that
Exactly.
standpoint. So I think I've always, and I share that with my leadership team, that premise, right? Like we should approach things with curiosity and really trying to understand where the other is coming from. The simple act of doing that
Hmm.
shows respect. And fundamentally, all relationships to be successful have to have trust in them.
Correct.
And one of the elements of trust is that you feel like the person has good intention towards you, which is that they respect you, right? So,
Yeah.
so just being curious and asking questions starts to create the environment and the atmosphere for success, right?
I wish you would have gave me these gems earlier in life, right? Because I only assume why he said what he said, and I'm gonna assume in the correct way. But if I were to ask the question, I'm pretty sure that's what he would have told me. But no, you are right. Asking questions, getting that information, and this is a question that's come up lately. Someone asked me, and now I'm asking other leaders: is that leadership? Is that something that is taught or something you're born with?
Oh, that's sort of like the nature versus nurture argument about, human development. It's
Yeah.
both, right? It's both. I think the the inherent or intuitive part is that you have to have some kind of inner desire to do it, right? That's gonna because leadership's not easy. People think that what you are perceived in the media and print and stuff, it's not easy to be a leader, right? So you have to have
No,
a
not at all.
desire internally to do that, and then you really do have to continually seek out in your career to learn more to how to do it better. And then if you're fortunate, as I am, then you can start to share it with others, right? Not as the person of wisdom, but really in a dialogue with people about here's my experience. I'm just sharing with you my experience, and that you can take what you want from it. You brought up another important part that leadership is something that you have to develop in people. And so my responsibility is we have multiple layers. We're a pretty good sized organization. We have 800 people that work for us. So we have multiple layers. We have 13 different clinical sites. So there's lots of people in leadership positions across the organization. All of them come with certain levels of skill and certain levels of maturity and certain levels of experience. And we have to continually invest in them because they're way more important than I am. I'm the CEO, okay, but really the people that are experiencing leadership are experiencing it right at where they do the work. So we
Correct.
have done a lot of work development investment in our frontline leaders because they're way more important than I am because they're the ones that are creating the experience for the folks doing the care. So
Hey, real quick, if you're enjoying the podcast, we first want to say thank you. And we also just want to give you a little insight of what we're up to at Francis. Some don't even realize that we're working with organizations to help them use AI to create that real human communication experiences, where that's actually supporting your families, those patients, or the entire community. We're actually creating tech that connects. Check it out, francis.ai. I'm glad you recognize that, right? A lot of times, as a leader, a CEO, we're at a desk, we're in an office, and some people, not you, because you're a great leader, forget to go back to where it all started. And me, it's like I'd never forget. I mean, if I was making subs in the front line, you'll find me during lunchtime making subs. Not that I needed to, but I felt that I had to show up, right? I wanted to practice what we preach. I wanted them to be fast, efficient. I wanted them to show customer service. I had to show them what that looked like, not just tell them.
Yes.
Because as a father, Tori, I'm learning, people don't listen to what you do or say. They actually watch what you do. So my kids are a learning example of that. So I love that. You talked about just investing. I think we're in a space now where we're really investing into something different, which is technology. We spoke about it last time we had a conversation, where people are looking for, especially in the healthcare. So many people were lost during the pandemic time because they were forced to do more of what they hated and less of what they loved. So now where I'm hearing AI transcribe is things that people are utilizing to do more of face to face. Instead of 15 minutes documenting, I can take 10 more minutes of that and just look at you in your eyes and have a conversation. Really get to know you. So what are you guys doing at Open Door to just not only invest into the individual through a leadership, but even technology to allow them to do their jobs better and do more of what they love? Is that something that you guys are into right now?
Very much so. Everything's interconnected, right? So, it's like the ripple of, when you toss a pebble in a pond, the ripple goes out, right? And it impacts things along the way. So for us, we look at three main things that we are always striving for at Open Door. So we live in a rural community. People always need access to healthcare, right? So we're always trying to figure out how we can expand our access, right? And then we're always looking at to improve quality, right? We want to make sure that the service that we deliver is always the best that it could possibly be. And third, and probably most importantly, we're trying to create an environment in which people like to work, right? Like we want them to go home and at the end of the day, we want them to feel like they made a positive contribution, and they wake up the next morning and they go, I'd like to go do that again.
Correct.
Simple, but it takes a lot to make that happen, especially in healthcare today. We don't have enough time in this particular dialogue, but people do what they get rewarded for, right? And right now we have a healthcare delivery system. Unfortunately, I work for a not-for-profit, right? I work for a community health center, so our motivation is different than a for-profit. But the healthcare delivery system in America really is a for-profit system, which makes it very difficult for people who have gone into healthcare to help people achieve that with a production-based system. So we pay a lot of attention to what brings joy and meaning to our staff. And it's not paperwork, it's not technology, it's taking care of people, right? So we're looking to leverage technology, and you gave a great example of that, so that people can spend more time taking care of people and not doing the mind-numbing and soul-sucking things like documentation and paperwork and those things. So I believe that there is great promise with technology such as artificial intelligence to help people get back to doing what brings them joy in medicine, right? And take away the things that really has decreased their motivation, like paperwork. So the electronic medical record came in almost 20 years ago, and it was supposed to revolutionize healthcare so that we could communicate better across multiple different levels of care in different organizations. And like most technology, it advanced quicker than we knew how to manage it, right?
Yeah.
And so it's taken us a while to catch up because it ended up, and most people will say this to you, like, I don't really enjoy going in to see my provider because they're on the computer and they're always typing something in versus looking me in the eye and talking with me, right? So if we can remove that barrier so that electronic requirement had created a barrier between patient and provider, AI gives us the potential to take that away, right? That the
Hmm.
provider can be back having direct communication, eye contact with the patient, like you and I are doing right now, and everything
Yeah.
is being taken care of in the background, right? So I believe we should always look at technology that will create the opportunity for that interaction to occur, right? And so
Hmm.
whatever we do, and technology advances very quickly, but we often have no idea of how to do anything with it.
You're so right on these things. I feel like people don't go see a doctor the way that they used to because the experience is not the same, right? It's all about the experience. We go to eat, we want a good experience. We go to Disney World, we want a good experience.
Yeah.
And it's the same thing when we go check for our health and how we doing. We want a good experience. And if we felt that we went somewhere and these bills are not cheap, Tori, okay? These bills that we receive
Yeah.
are huge bills. And we think like, wow, you guys are charging me all that. The person doesn't even know me. The person barely gave me the information that I needed. I got to go see another doctor and then another doctor. So it becomes so difficult. But I can imagine it's not the clinician's fault. It's just the system, just how the system has been created. But there's pieces. I'm hearing, I'm almost at this point talking to so many leaders in the healthcare space that I'm like, I want to go see a doctor and see what the experience is now. What AI transcribe, is it really working? Did the experience become a little bit different? I shouldn't go now, Tori. I should wait a little bit.
Yeah, it's still not quite there, but the potential is there.
Love it.
And you know what my job as a leader is to create the environment that people feel like they made a positive impact and they want to come back the next day, right? And so we always have to look at that. And if we want, it's more important to keep someone than to recruit somebody new,
Hmm.
right? Because
Yep.
and the system is evolving. When your parents grew up, potentially they would have a provider their entire life, right? But
Yep.
that's not the system that we have now, and that's not necessarily bad. But what you want is consistency in the team. The care we deliver now is much more team based than individual based. And another expression that I use in leadership, um, and I did not come up with this, I learned it from others. There's an expression that says if you want to go fast, you go alone.
Heard it.
You
Yeah.
want to go far, you go together, right? And
Yep.
so, and it also is if you want to do something hard, you have to do it together because a team is much more capable of overcoming something difficult than an individual.
You there's so many leaders that are asking themselves right now, and you, someone that has built culture, that learns and evolves. Like, if someone's listening to right now, what is that first move that you tell the nonprofit leader they should really start to think about?
Well, yeah, I think it goes back to when, especially in the nonprofit spaces, you're working for an organization that has a mission, right? And so your job as the leader is to make sure that you can fulfill your mission. And then you work backwards from there, right? You begin with the end in mind, right? And then work backwards from there. And then I think probably the next thing is hiring the right people. You know, if you hire the right people that are in alignment with your mission and in alignment with your values, you can teach people anything. You can't teach them to be aligned with your mission, right? So I think it goes fundamentally, we should never underestimate, especially in the healthcare sector, the power of people versus
Hmm.
technology, right? There are very other industries that are very tech heavy and you need the technical expertise. But I mean, from a nonprofit world, you really want to have people that are aligned, and your people are your most important resource. So I would say start with that in mind, right? That have the right people, have the right culture, then you can do anything that comes your way.
And it takes time. I want people to know it takes a little bit of time. It's like dating. I always say, find the right person is like dating. Okay, just how we had to find the right spouse in our lives, it's the same damn way when you go look for people to go work for you. It's not going to be the first person. It might not be the second. It takes a little bit of time. One cool thing that I think you've mentioned the last time we spoke as well was you're taking kids inside clinics in junior high.
Uh-huh.
What was the mindset of let's start young. Let's show them this opportunity at a young age.
Well, our experiences guide our beliefs, right? And
Hmm.
so we forget sometimes that it's not all about just being didactic in learning, it's the experiences that you have. And so if you aren't growing up in a household that your parents are involved in healthcare, how would you get exposed to it? It's the few times, and generally, the younger you are, the less you need healthcare,
Yep.
right? So, how would you even know what a career in healthcare is like? And if you're only seeing what's on the media or TV, that is not reality. And so, it's important for people to be exposed to what the opportunities are. And so we have to create that opportunity, and it starts early, right?
Yeah, I agree.
So, yeah, and that's why we have tried to, in a rural community, our greatest opportunity for people to be recruited essentially is from within the community, that they have to go off to maybe get the advanced training, but their connectivity to the community starts early, and then people migrate back, right?
I love that. See, that's good leadership right there, Tori. That's a good leadership. What are some of the things you guys are offering at Open Door? For those we've heard Open Door throughout this whole conversation. But let's talk about some of the program and services that Open Door offers. You know, you think 7 locations. There has to be some good stuff there that people may not know even know exists.
Well, we're part of the community health movement. So we're a community health center, right? And the community health center movement actually started as a social justice movement over 50 years ago. We forget, but we're going to unfortunately rediscover here that there were times when tens of millions of people had no insurance in our country. And then if you don't have insurance, your access to healthcare is very limited. And
Hmm.
that's where the community health center movement came from, is because we had tens of millions of people that couldn't get healthcare because they couldn't afford it. And with the Affordable Care Act that happened 12 years ago, suddenly everybody had coverage, and suddenly we were able to do more things. So community health centers started off in the social justice, and now we take care of over 35 million people in this country are cared for in a community health center,
That's
right?
big.
And so we've really become a major part, especially in the primary care world, right? As part of the delivery system. And we take care of the folks that are often underserved compared to other parts of the healthcare system. So, and 50 years ago, we spent a lot of time around mom and babies. And now, because of the demographic changes, we are becoming very competent and capable providers of senior care, right? Just because the demographic. I did some projections on our current patient population, and within 5 years, we will have the same number of Medicare patients as we do of Medicaid patients. So, which is very different than most community health centers. So, for us, for example, we provide essentially all the services from birth to death, right? So, we do OB, right, and do family practice, family medicine. We do behavioral health and mental health services. We have a pharmacy, so we can provide pharmacy services to our patients. And then we do dental care. So the idea
Wow.
behind a community health center was that you could come to us and receive almost every service that you need. So we certainly coordinate with the specialty care, right, from that standpoint. But the idea is that we would be the center of your medical home and that you could get everything you need here. And we've done a pretty good job of that. So we actually have 13 clinical sites. We serve 2 counties the size of Connecticut. We see over 60,000 people a year. We do over 350,000 visits a year with folks. So we've gone from being a small little free clinic in the college town to the largest provider of primary care in 2 counties. So, and our journey is similar to many other community health centers.
That is cool, man. I mean, the growth is real. How long you been with the organization now, Tori?
6 years.
When you started, how many locations did you guys have?
Same, the same. We're in
Same.
a pretty consistently stable environment, being in a rural area. People forget
Got
how
it.
big California is. We're way up in the
Yeah.
northwestern corner of California. We call it behind the redwood curtain, behind the redwood trees up here. So,
Well, I love it, Tori. Tori, we're actually coming to an end here,
yep.
man. So, where can people find? Where's the website that people can find more information on Open Door? If people can connect with you on LinkedIn, are you on LinkedIn? So they also know that information. Just any socials that people can go and check out.
Sure. Yeah. I mean, we have the classic social media. So we have a web page, we have a Facebook page, we have an Instagram page. There's more than one open door in the country. So we're the one in northwestern part of California. I am on LinkedIn from that standpoint. So we're easily found if you want to look. There is other open doors throughout the country, but we're the one in California.
Probably the one they should care about, right? I'm just
I
joking.
think all community health centers are important.
Just joking. No, I'll leave you with this blind question, Tori. Of course, I had to cater it to you as well. If you could write one prescription for America that has nothing to do with medicine, what would it be?
I think we need to get back to realizing that we're all in this together and we should stop fighting with each other and learn how the joy of working together is there.
That is so crazy. You're the second person I spoke to today that said that. Like, we just have to help each other. And it is true.
Yeah.
So many times we're divided. Even organizations sometimes that could really come together to be very powerful are still divided because of just how
Yeah.
we see the world, how the world has really taught us to be in a sense. So I love that you said doing it together, you know?
I would do one other prescription.
Go ahead, go ahead. What is it? What is it?
I would say don't pick up your phone for at least an hour after you wake up and put your phone down at least an hour before you go to sleep.
Damn, Tori, you're talking to me, okay? Sorry. I'm going to put my...
Your
I love
world
it.
will be a better place if you do that. I can guarantee
I
you.
hear that. I'm trying. I'm gonna try. I'm trying, man. It's when you grow up with this in your hand, it's like I can't let it go. Terry, what is your blind question to the next leader?
Excuse me?
What is your blind question to the next leader? You have a blind question you want to give to someone else?
Oh,
If you're not, it's all right. I just thought maybe you
no,
wanted to pass along.
no, I think it's interesting. I've been fortunate. I didn't have a career path, but I just kind of always kept open. And when you keep your eyes open and you're open to potential, lots of opportunities will come your way.
Love it, brother. Well, Tori, it's been a pleasure, man. I can't believe how time just really flies. This is why we got to just do more of just conversating, right? Like, there's so much to provide in a conversation. And I love it because sometimes I have conversation with friends, and I'm like, if only this was a podcast. Because there'd be so many things that we talk about that people need to hear. And I love that you were just so open, authentically yourself today and allowed people to understand the healthcare world just a little bit more. But also all the insights if you've grown, I mean, you've had and dropped today after 30, 40 plus years just in the healthcare space and still loving it. Right? Still loving it, still having a passion for it. So thank you so much, Tori, for the conversation. Guys, if you guys want to hear more conversation like this, so just continue to share the stories, really being able to make impact because a lot of the times change starts with someone hearing a story. So hopefully this actually resonated with you. You guys make sure you guys do tag someone in the comments. Make sure you guys do share. And also, just check out Tori on LinkedIn, man. This dude's doing some phenomenal things. But Tori, we thank you. My name is Efrain. This is Tori. We'll catch you guys in the next episode. Laters.
Bye.